Hello, Dr. Gonzalez. My wife and I have been trying to become pregnant for some time now. We've exhausted all of our options, and frankly, we're running out of options. Do you recommend anything else that we can possibly do, or find out why we can't become pregnant?
We have been under the impression that I was the cause of the problem, but now after getting checked, although he may not want to admit it, he may be the cause of the problems.
Okay, it's difficult to properly diagnose you due to having symptoms that are typically found in other conditions, but I would like to perform a karyotyping test on you, and that's usually performed through sampling of tissue, either the blood, amniotic fluid, bone marrow, and even the placenta. In your case, we can do the testing of the blood and maybe the bone marrow if necessary. Um,
Interesting. And what exactly would you find from these results?
The use of karyotyping will allow us to closely examine the number of chromosomes as well as if there are any structural changes in your chromosome.
Having said that, how exactly can you determine if my husband is indeed a carrier?
Well, it's difficult to properly diagnose you due to having symptoms that are typically found in other conditions, but I would like to perform a karyotyping test. These are usually performed through sampling of different blood, tissues, amniotic fluid, bone marrow, and the placenta. In your case, we'll be testing your blood and maybe your bone marrow if necessary.
Interesting. And can I ask what exactly would you find from those results?
Well, the use of karyotyping will allow us to closely examine the number of chromosomes as well as if there's any structural changes in your chromosomes.
Well, how exactly can you determine if my husband is indeed a carrier?
Well, if your husband is indeed a carrier, the signs are expressed differently from carrier to carrier. Typically, the signs for the syndrome occur early during adolescent years, but most often than not, males don't find out until their adult years. The issue in identifying the syndrome is mainly due to symptoms overlapping with other typical cases. This may include, but is not limited to, smaller tests within itself and can lead to several conditions. One, a lower production of testosterone, and in your case, infertility. When we review the results of the karyotyping, we are looking to see if you have any of the typical normal structure of 46 inherited chromosomes. The distinguishable differences in Klinefelter syndrome is the additional X inherited chromosome from the mother.
Okay, so how does this occur?
The determined cause of Klinefelter syndrome is related to a process that occurs during formation of the egg and the sperm. So the failure of the separation of the sex chromosomes can lead to an extra X chromosome. Once that one cell is copied with the additional X chromosome, all the other cells follow the same pattern. So this is referenced or referred to as a non-disjunction.
Interesting. So where do we go from here? Are there possible treatments that I can undergo, or is there a chance that we can increase our fertility?
Klinefelter syndrome isn't exactly my area of expertise, but I would be more than happy to refer you guys to a specialist that can discuss the existing treatments that you may undergo.
Hi, I'm Dr. Harkowitz. First of all, I'd like to inform you that you're in a situation that many men find themselves in. Klinefelter syndrome is very common. 1 in 1,000 men are found to be diagnosed with the syndrome.
So Dr. Gonzalez was saying that possible treatments exist for his condition?
Yes. Actually, with today's technology and advancement in medicine, your husband has alternatives to combating the effects of the syndrome. The most common form of treatment is hormonal replacement therapy. Low testosterone levels can be raised by taking supplemental testosterone by injections every 2 to 3 weeks through pills or transdermals.
Interesting. And this will cure him?
No, it will not cure, but it will increase and replace the hormones that are expected to be created by the testes. This synthetic testosterone that would be administered through injections would behave similarly to natural testosterone and lead to growth of hair and muscles as well. A common effect of Klinefelter syndrome, although in your case you are considered infertile, options do exist that allow you to conceive. Artificial reproductive technologies is one option. This would involve the microsurgical extraction of sperm with the combination of in vitro fertilization. This procedure challenges the previously false assumptions that men were diagnosed with the syndrome were completely sterile. Treatment for infertility, advances in assistive reproductive technologies have made it possible for some men with Klinefelter syndrome to conceive. A type of assistive reproductive technology called testicular sperm extraction with intracytoplasmic sperm injection is a procedure where the sperm is removed from the testes and placed into an egg. Some goals for the patient: seek treatment right away, join support groups, and educate yourselves and also others.
Okay, so if we do decide to undergo the recommended procedures, what are the chances, if any, that our child can inherit the symptoms?
As I was informed by my colleague, there has not been an established correlation between offspring by those who are able to conceive. So the indication that your child might be a carrier is not guaranteed.
Are there any tests that we can perform? Because as Dr. Gonzalez informed us, this syndrome can typically be diagnosed in young adolescent years. So is there a chance that we can predetermine if my child were indeed a carrier, so we can prevent him from having to go through this?
Absolutely. There are methods of testing the fetus for the syndrome.
Interesting. I know we have yet to be pregnant. Can you inform us on how such tests are conducted?
Well, I am not one to provide with full information. I would recommend you to a great genetics specialist, but I can provide you with the overall concept of the testing. There are two types of sources that can be extracted a sample from. One being an amniotic fluid or the placenta. From here, a karyotype test is performed that is similar to the one that was performed with a sample from your husband. From here, it would be used to determine the proper diagnosis. This is referred to as prenatal diagnosis.
So then what you're saying, doctor, is since you're able to diagnose it properly way beforehand, can you cure my child from it?
Unfortunately, once the diagnosis of Klinefelter's is established, there does not exist the possibility of curing the fetus. It is not possible to remove an ill-structured chromosome, similarly to your case of any other individual in your situation. Treatments do exist, and early detection simply means early treatment.
Well, I am willing to perform whatever test necessary to know in advance if my child would face such complications down the road.
Excellent. I am glad to hear that now more people are informed about the syndrome that affects so many.
Dr. Harkowitz and Dr. Gonzalez suggested great alternatives for us to becoming pregnant. The only consideration I have is if I were to undergo the hormonal therapy, the associated risk that it comes with cardiac problems. What do you think?
I agree. I think that your health is more important. Yes, we would like to get pregnant, we'd like to conceive, but I think your life is more important at this point.
Yeah, obviously I agree. But we do have other options. She did mention the in vitro, even though I do think it's kind of costly and we possibly can't afford that right now. We could make a long-term plan and see if we can reach that goal.
Yeah, I think we will be able to reach that goal.